We talked about neuromodulation in the last couple of talks, and what I'm going to talk about are actually some more biologic advancements in the treatment of back pain secondary to degenerative disc disease. Obviously, we're always looking for a fountain of youth, a way to rejuvenate our backs as we get older so that we don't experience back pain. These are some of the trials that are ongoing with regards to what we might be able to do to turn back the clock, and then I'll end with some of my own personal thoughts and opinions about potential shortcomings of this approach. No financial disclosures. So we already talked a lot about causes of low back pain. Obviously muscle strain, facet arthropathy, spinal misalignment, scoliosis. Debatable whether or not spinal stenosis causes low back pain, though in my personal experience I think it can. And degenerative disc disease. So what is degenerative disc disease? Why do these things result? Well, really it comes from us evolving from a quadruped to being a biped. So as we go from this posture to this posture, there's a lot more strain on our lumbar spine in terms of stress and weight bearing, and those physical stressors can definitely lead to changes that subsequently result in low back pain. Now, according to this cartoon, the final step in evolution is actually an astronaut, but I'll venture to say that it's actually Dr. Dean is the next step. So what is degenerative disc disease? Well, disc is consisted of the annulus fibrosus, the outer ring, with the center nucleus pulposus, the jelly of the jelly donut, if you will. And the nucleus pulposus is composed of proteoglycans and type 2 collagen. So not quite the same kind of collagen that you might find in joints or elsewhere in the body, but specific to intervertebral discs. And these proteoglycans and type 2 collagen help retain water content within the nucleus pulposus. Over time, however, the nucleus pulposus loses water content and therefore becomes less resilient to external stressors. And that decreased resiliency leads to fissures in the nucleus pulposus and eventually also the annulus fibrosus. So we've all seen this MRI scan. Patient comes in, their L4-5, L5-S1 discs are darker than the superior discs because they've lost water content over time. You might see some annular fissures here or here, and they complain of axial back pain, mechanical back pain with movement. And we say, well, what should we do? We can certainly send them to physicians like Dr. Rizzo, incorporate a physical therapy treatment centered on baseball philosophies, or we can send them to Dr.